Welcome everyone to our webinar, Inclusive Design and Age-Friendly Communities, facilitated by the Fall Prevention Community of Practice. My name is Mariel Ang, and I am the Project Coordinator at the Ontario Neurotrauma Foundation, or ONF. ONF sponsors the Fall Prevention Community of Practice and its online platform called Loop. Loop is a place where fall prevention practitioners connect. Visit us at www.fallsloop.com. We would like to mention our promotional partners for this webinar, the Ontario Professional Planners Institute, who have promoted this event to their membership. If you are a member of the OPPI, we welcome you and thank you for joining us for this webinar. Marguerite Thomas also joins us on the line. Marguerite is the coordinator for the Fall Prevention Community of Practice. She will be assisting us with facilitating questions in the chat box today. The Level 3 system provides visuals through the web meeting platform and audio through your computer speakers. Please adjust the volume on your computer in order to hear the presentation. If you are unable to hear the presentation through your computer, you may also call in to the teleconference line. The phone number for the conference line and the link to the webinar platform were sent to you by email after you registered for the webinar through Level 3. If you have questions about the technology at any time during this presentation, please type them into the chat box on the left-hand side of your screen. Alternatively, you can email me at Mariel, that's M-A-R-I-E-L, @onf.org, and I'll work with you to resolve the technical issues as soon as possible. There will be a question and answer period at the end of the presentation. If you have a topic-related question throughout the webinar, you may type them into the chat box at any time during the presentation. During the Q&A, questions will be read aloud to the group and presenters will be invited to answer. The webinar is being recorded and a YouTube link will be sent to all participants in about 1 week along with the presentation slides. Before I introduce our presenters, I would like all of our participants to complete the following poll on your screen. Please rate the knowledge on this specific topic before the webinar, and the answers are below. I will give you all a minute to complete this poll. We would like to capture your level of knowledge on the topic matter before and after the webinar. Perfect. I'm seeing some responses come in. Thank you all for participating. I'm going to close the poll. I would now like to introduce our presenters, Jordana Maisel and Brittany Perez. Jordana is the Director of Research Activities at the Center for Inclusive Design and Environmental Access, or IDEA. She co-directs the Rehabilitation Engineering Research Center on Universal Design and the Built Environment and is a project lead in the RERC on accessible public transportation. She's the principal investigator and co-principal investigator on several other research studies. She co-authored the Goals of Universal Design and recently co-edited Accessible Public Transportation, Designing Services for Riders with Disabilities, Inclusive Design, and Universal Design, Creating Inclusive Environments. Brittany is Director of Outreach and Engagement at the IDEA Center at the University at Buffalo. She co-leads a federally funded field-initiated research project on wheelchair securement in public transportation. Brittany coordinates usability studies and leads IDEA Center efforts in advocacy and community engagement. She co-funded a local advocacy network called Age-Friendly Erie County and AARP and WHO Age-Friendly Community. Brittany is the Assistant Director for Community Outreach in the University at Buffalo's Center for Successful Aging. And without further ado, please take it away, Jordana and Brittany. I am about to unmute you as a presenter.
All right. Good afternoon, everybody. This is Jordana starting us off. So thank you, Mariel, for having us, and we're thrilled to be here this afternoon to speak to the Fall Prevention Community of Practice. So as Marielle said, Brittany and I will be talking about inclusive design and age-friendly communities, and we're just going to jump right into it because Brittany and I have a lot to say in a short amount of time. So you heard our bios, but just to give you a little bit more background about the center. So the IDEA Center was founded in 1984, and our primary goal is to produce knowledge and tools that will increase quality of life for groups who have been marginalized by traditional design practices. So we're housed within the School of Architecture and Planning at the University of Buffalo. And I think what makes our center unique is that we're multidisciplinary. And so whereas my background is in engineering and urban planning, Brittany is an occupational therapist, and we work with industrial engineers, the School of Public Health, and so we're quite diverse in our skill set. And so just to go over the objectives we have for our next hour together, first we're going to identify the need for universal design, and perhaps some of you were on the webinar I gave about a year ago. This won't be a complete replication of that, but I want to just refresh your memory about why we need universal design, talk a little bit about the goals of universal design, and then we're going to shift into this relationship between fall prevention and universal design and some of the risk factors both indoor and outdoor environments. And then we hope to leave you with some research, tools, and best practices that you can use to help create more inclusive, age-friendly communities yourself. So we're diving right in. And so the real need for universal design, you might be asking, really stems from this idea that we all experience barriers in our environment. We're focusing on the built environment here. And while great strides have been made since the 60s with the disability rights movement, the civil rights movement, in gaining more rights for people with disabilities, and which led to, in the U.S., the Americans with Disabilities Act, we still have a long way to go. Oftentimes you will see something like the images you see on your screen right now, this idea that there is an accessible entrance to a building, but that oftentimes it's around the corner, in the back, in some obscure location that leads a family to be separated. So those who require that accessible entrance can't use the same entrance as everybody else. And so it's this idea that accessibility is not the same as universal design. And I think if Brittany and I left you with anything today, it would be this idea that they're not equivalent. And here's another example. So here you're seeing an image of the Holocaust Museum in Washington, D.C., and this is the Hall of Remembrance. So it's a very solemn, reflective, peaceful place where there's an eternal flame, where you can imagine there's an older generation of people coming to visit on a daily basis. And you can see from the image that there are steps leading down to this peaceful, solemn place. Well, obviously, this is not accessible, and things needed to be done to improve that access. And so this was the solution. So you have a lift that's leading down into the space. And you can imagine that you're having a moment, it's quiet, it's silent, and all of a sudden this motor starts, totally taking you out of that reflective mode, and it draws unwanted attention to the people who need to use it. It's an eyesore. Countless negatives about this. So while it's an accessible solution, it is not truly a universal design or inclusive solution. And we're going to talk a little bit more about what does that mean. And so it's really this need to shift our thinking on how do we create more built environments that work for everybody, and they create a seamless opportunity for people of all ages, all abilities, across different domains of the built environment. And so we're going to dive into that now a little bit more. So what is this idea of universal design? And you might hear Brittany and I refer to this as universal design, inclusive design. In Europe, it's often design for all, and it means the same thing to us. So we use these terms interchangeably. But our definition of universal design is that it's a process that enables and empowers a diverse population by improving human performance, health and wellness, and social participation. And so there's some key terms in this that we're going to keep coming back to, but I just want to point out one of them here being this word process. That our idea of universal design is that it's an evolutionary concept, that we do the best we can in the situation we're in with this idea of always trying to improve. It's an iterative type of movement, and so at the time we do what we can and always look to improve. And then there are these three key outcome areas: human performance, health and wellness, and social participation. And while earlier definitions of universal design and even accessibility tend to focus on that first element of human performance, at the Idea Center we really embrace this idea of we also need to look at health and wellness and social participation. It makes no sense if we create more usable environments for people if they're still isolated from the rest of the community. So to accompany that definition of universal design, we've established the 8 goals of universal design. And these are evidence-based, outcome-oriented goals to support the definition and to really link research to practice. So from this graphic, you can see that with those 3 key outcome areas, we have specific goals related to those. And what I'm going to do over the next few minutes, I've done these 8 goals in 6 hours, but I'm going to try to do them in 10 minutes now, but really show you what is the knowledge base that is linked with each of those key outcome areas. So the first goal of universal design is this idea of body fit. And it's about accommodating a wide range of body sizes and abilities. And if we were to link this to a knowledge base, it would be the field of anthropometry that some of you might be familiar with, which is really the study of body sizes and dimensions. And it's how do we provide different spaces for people. This image is at the Pittsburgh Children's Museum. There was a water exhibit, and children were going into the water exhibit, and grandparents were accompanying them, parents, and they came out of the exhibit soaking wet. And so this creative idea to have these different dryers was there. And you can see that people of different heights can use them. It's a creative way of providing an innovative solution to this idea of body fit. So the second goal of universal design that also falls within that human performance area is this idea of comfort. And so how do we reduce the level of effort that people need to use products, to use the built environment? And if we were to link this to a knowledge base, it's the science of biomechanics, the forces on the body both at rest and in motion. And things like thermal comfort would also fit into this. Ideas of convenience would fit into this goal of comfort. And the image you're seeing is of the OXO Good Grips line, which is probably used most often to depict a great example of universal design. And really, the short version of the OXO Good Grips story is that the inventor was looking to create a product for his wife who had severe arthritis. And she loved to cook and was having a really hard time peeling vegetables and gripping the different kitchen instruments. And so he played around with different models and stumbled on this black, thick grip that is not only functional but also aesthetically pleasing. I know this is what's in my kitchen now. And it's this idea that it works for everyone. So while it was perhaps designed as an assistive technology for one specific need, the benefits transcend that specific need and extend to people of diverse abilities. And so it provides an easier way to do a monotonous task and reducing the effort, the grip effort, the strain on the wrist, etc. So the third goal of universal design is awareness. And again, still under this human performance outcome. And awareness is really about how do we receive critical information from the environment. What is the way the stimuli is coming to us? And so it's linked to the science of perception. So in this image, you're seeing key information being conveyed in a lot of different methods. So there's color that's denoting a message, there's text, there's a pictogram. So we're receiving the information in a variety of different ways because some of us process information differently. You can imagine, even if you don't read, if you don't speak English, that you could get that information is trying to be conveyed to you through this image. So hand in hand with awareness is the goal of understanding. And so they're pretty closely linked because it's not only enough to get information from the built environment, but you have to be able to process it and make sense of it and know what you're supposed to do with that information. So that's the goal of understanding, which is linked to cognition in the literature. And so these images are really help describe this idea of how we design using conceptual models. So the upper left image is the traditional faucet design. We're very familiar with how this works. You have hot on one side, cold on the other. There's an H at the top of it to indicate that that side is hot. And that's how the traditional faucet began. Then if you move to the upper right, we moved to this lever format because, again, going back to this comfort idea, the lever was an easier way to turn on and off the device. You can see that there's a red indicator on the left side to indicate hot. So it, again, is consistent with our conceptual model of two faucets, one side being hot, one side being cold. Then we move to this single lever idea, which starts to deviate from our understanding or our conceptual model of how faucets work. And while it's fine to deviate, the important thing to know is that with any new idea, new product, there is often a learning curve that is associated with it. So this became a little more challenging for some. And then we've evolved to the image in the bottom right corner of a hands-free tap-on, tap-off faucet. And while it has tremendous benefits in the kitchen, especially in terms of sanitary and when you're cooking and the ease of it and the comfort, you can imagine that this device, that this faucet does not make sense in every environment. So in an assisted living facility, obviously this deviates so far from our conceptual model, traditional conceptual model of how faucets work, that it would be totally disruptive. And so the key here, the message I'd love to convey is that not every design is appropriate in every situation, and you have to know who you're designing for and what makes the most sense. And recognize that there might be a learning curve that's involved when introducing something new and innovative. Okay, so those first four goals were related to human performance. And then there is that next goal of wellness. And there's tremendous literature on health and wellness. It's so diverse that too much to really pinpoint here. But the idea of wellness is that we're trying to contribute not only to not only addressing diseases once they exist, but how can we promote healthier behaviors and avoid disease and hazards in the first place. So in this example, in this wellness picture, you see in an assisted living facility, there's outdoor planters that are raised off the ground that allows older adults to get outside, to interact with each other, to engage in some gardening. And it's just being mindful of how do we promote these healthier behaviors in different contexts. Okay, so then the last three goals are really linked to this idea of social participation. The first goal is social integration. And it's really about treating all groups with dignity and respect. And it goes back to that earlier image of the two entrances, that accessibility is not the same as universal design. So if we're relegating some people to a side entrance through a kitchen, even though it's accessible, we're not treating them with the dignity and respect they deserve. So this image is a real close-up of the Guggenheim Museum in New York City, the inside of it. And as most of you probably know, it was designed by Frank Lloyd Wright in in the, I'm getting it wrong, I think it's in the late 40s. So it's well before the disability rights movement, before these ideas of accessibility and universal design came about. But it's really a great example of social integration. The story goes that Frank Lloyd Wright was not really excited about the idea of building a museum, couldn't really think of a fresh take and an innovative way to design a new experience for people in the museum. But then he stumbled on this idea that what if everyone entered the building the same way, took an elevator up to the top floor, and then used this wraparound ramp system to negotiate and move through the space the same way. And it's a great example of social integration. Everyone is experiencing the museum the same way. All right, moving along to personalization. So it's this idea of incorporating opportunities for choice and preferences in our designs, that we should have some flexibility in our designs to allow some personalization, some control over how we use and modify a design. So I think a smartphone is a great example of this. If everyone took out their smartphone, I think they would look, if there's 100 people signed into this webinar, I think they would look 100 different ways. Some of us are folder people, keeping our apps very organized. Some of us have pages and pages of apps that we scroll through. Some of us use the accessibility features like the vibration, put different sound preferences on different calls. So there's ways to personalize the device so it works best for us. And it's a goal that we should incorporate into our designs, that not everyone is going to use or experience a space the same way. So how can we build in this flexibility into our designs? Okay, so that brings us to our last goal of cultural appropriateness. And it's really an idea of respecting the social and environmental context in which we're designing. And I've alluded to this throughout the other goals. But it's that we need to be context sensitive, that the same design does not work in all places. Very quickly, this image that you're seeing is of Canalside in Buffalo, New York. It was recently built up, and it was a great location down by the water in the summer. Concerts would be there. There's boating opportunities. But although we love Buffalo, and I don't want to make any weather jokes, we need to be mindful that the weather here is not always conducive to those outdoor warm weather activities. And so in order for this space to be used 5 months of the year, it needed to provide a different service or a different activity. And so there's now an ice skating rink. There's different winter sports that are down there. There's curling and different restaurants. And so you need to be mindful of where you're designing and that it reflects the climate, the culture, and the people that will be using the space. So those are the 8 goals of universal design that really serve as the foundation for all the work we do. And now I'm going to turn it over to Brittany, who's going to transition a little bit to what is that link between fall prevention and universal design.
Thanks, Jordana. So yeah, we'll continue the conversation and talk about the context of universal design related to fall prevention, which is a topic this crowd addresses from many different perspectives. We're going to focus today on the environmental perspectives of fall prevention and hopefully build some links to best practices with design for fall prevention through examples in age-friendly communities and other efforts that are looking to address falls through environmental context. So not to be preaching to the choir here, but we know that falls are a leading cause of injury-related mortality in older adults, and that at least here in the United States, there's some economic perspective that they're costing more than $20 billion each year. And as we move forward and our aging population is growing, the total annual cost of fall-related injury and the medical care associated with that is only going to increase. So it's really a crisis that we need to address, and it needs to be prioritized at the level of some of the other health conditions that we spend a lot of money addressing in our country. So the World Health Organization identifies 4 specific categories of the risk factors for falls: biological, behavioral, social and economic, and also environmental risk factors. And as I mentioned, we're going to focus this afternoon on the environmental risk factors, and many of you might be experts in different areas of these risk factors. And combined, we can create different spaces and communities where hopefully people fall less. So getting right into it, when I'm focusing on older adults in the community because older adults are our primary population who are experiencing more frequent falls. And a lot of research from lots of different places indicates that older adults do want to remain in their homes and in their communities for as long as possible, this idea of aging in place. Additional research into falls has also indicated that most indoor falls tend to occur among more frail older adults, and that outdoor falls tend to occur among more active older adults. And this may make sense because more frail older adults are living in their homes and have more difficulty with community mobility, maybe go out and walk less than more active older adults. But what it brings to light is that environmental factors exist both in the home environment and also in neighborhood and community environments. And if we want to address environmental risk factors for falls, we have to look at both. So if we think about indoor solutions first, and kind of where a lot of fall research is focused on, and where there's a lot of also clinical attention to indoor home environment solutions, like occupational therapy and physical therapy interventions in the home, ranging from strengthening and increasing balance to home assessments, and figuring out how different low-cost solutions can be mitigated in the home. Maybe it's arrangement of the rugs or the furniture, or where different commonly used kitchen items are located. These are interventions that we're familiar with that are occurring in the home. And when we think also of what's occurring in the home, we think of environmental modifications that can result from those environmental assessments or home assessments. And so this could be, like I mentioned, from low-cost, no-cost solutions to much more significant architectural modifications, or the use of assistive technology in the home, or the integration even of mainstream products that have a built-in adaptive use for different uses, whether you use a handheld shower as pictured in this photo that's integrated with the regular shower head at the top. Maybe you use it for helping to wash the dog, or different things, but also it can be helpful if your bathing needs change and you need to be seated and be safer in a shower environment. And then also when we think about the home, we think about environmental modifications that include access to the home. And some of you may be familiar with efforts like visitability policies, which visitability usually refers to 3 factors, like a zero-step entry into the home, wide enough hallways to navigate and move around the home, and a bathroom located on the first floor of a home so that someone who quote-unquote visits can visit and stay for a while to visit whoever they're visiting in their home. And then the range of home modifications can move all the way into this idea of home design for the lifespan, or designing a more universally designed home. And this picture here is an example of a home modification that was done by an architect in our office at the Idea Center. The homeowner on the left picture was using a temporary ramp solution to get into the 3 steps of their front door to more easily get into their home. And Then when our architect went in and did some consultation with them, they were doing obviously a large-scale modification of their home, significant modification to the entrance of the home. They decided they wanted to integrate the ramp directly into the design of the front entrance. So you may or may not have noticed that there are still 3 stairs to access the front door directly adjacent to the front door in the right picture, but there's also a ramp adjacent to those stairs that looks nice with the front entrance, and this is a solution that will be useful for not only the current resident who has these specific needs now, but potentially for future residents who may live and own this house in the future. One example of an evidence-based approach to addressing fall risk factors in the home is a program that started from Johns Hopkins Healthcare Solutions. It's called the Capable Program, or Community Aging in Place, Advancing Better Living for Elders. And what this program is a 5-month program that delivers services to community dwelling older adults to decrease fall risks, improve their mobility, and improve their ability to do their daily tasks. And they do this by providing 6 visits from an occupational therapist, 4 visits from a nurse, and at least up to a full days of work from a handyman who would be able to make the environmental modifications affiliated with the clinical visits that the participant might be given in this program. And what their research is finding is that over time in participating in this program, there is a large financial return on investment that roughly approximately $3,000 worth of program costs and participation is turning around about a $20,000 cost savings in medical costs that are both related to inpatient or outpatient expenses. And you can read much more about this program on the Capable website through Johns Hopkins. But it's a really nice way to tie together a lot of those in the home environmental risk factors with an evidence-based approach of how to address those. But one area that is not often addressed as strongly in the research, or that we know about in the research, is this idea of indoor environments that we encounter in our communities. So when people are going to and from work, or when they're going to and from different community spaces like the grocery store, or even retail shops in different types of spaces. And I'm going to stay here at the grocery store to talk through an example here. There's not a common, even clinical approach to evaluating these types of environments. It's pretty rare that someone would get their own personal assessment of their ability to negotiate through a grocery store and get their groceries. So what we know about fall risks factors in indoor public buildings and spaces is very little. And if we're talking about fall prevention and fall risks for community dwelling older adults, we've got to have tools to help us with evaluating these spaces so that we can improve them for a diverse population of people and reduce the risk for falls when people are out in the community. So I want to share with you one tool that kind of complements what we have as a set of minimum standards for the regulation of these environments. So in the United States, we have the Americans with Disabilities Act, and this does address public buildings and spaces. It gives a minimum standard, a minimum set of guidelines for design in these spaces. But our research in the IDEA Center has shown that some of the guidelines really are not meeting the needs of our increasingly diverse community. So mobility devices are getting larger. More people are using mobility devices out in the community, for example. So more modern research has given us more information that helps us to know that there are better design strategies out there, that we've got to go above the minimum requirements of legislation like the ADA to improve these spaces. And one such tool is a tool that we've been working on at the Idea Center for quite some time, and it's grounded in several of our different research studies in the center. For example, I mentioned talking about wheelchair sizes. So the Idea Center conducted an anthropometric research study collecting data about the size and space that different wheeled mobility devices take up. So we have a database of over 500 wheelchair users, and the dimensions of their chairs and also the dimensions of different actions that those people take in their chairs. And what this database has helped to inform is better design resources for creating more usable spaces for things related to and beyond guidelines in the ADA. One thing that's come from a lot of our different research studies is this tool called Innovative Solutions for Universal Design, or ISUD, which we've been calling for short. And ISUD is a website at thisisud.com, and it's a set of over 500 solutions that are evidence-based and cover a wide variety of different topics in indoor commercial buildings or public buildings. So exactly those types of environments, like places of employment, retail shops, grocery stores, different things like that. And what's unique about this tool is that it's not just a set of design guidelines. It addresses the design process, as you can see here is one of the first chapters, and talking about who should be involved in creating these spaces. And it goes all the way through different parts of what that space might be through the different chapters, and all the way down to services and policies. So identifying that inclusive design isn't just something about the physical or the built environment, but we can also create services and policies that create more inclusive environments as well. And so just to show you another example of how it's not only addressing indoor features in the indoor parts of these public spaces, but it also does address some of the features in the outdoor or site around these spaces as well in the website. And this tool, ISUD, as you would go about and use it on the website, it incorporates best practices. So each of the solutions is often paired with a best practice in that design solution, or includes design resources that are evidence-based that you can review and use yourself as you use this tool. And as you can see at the bottom of the slide, it also identifies what phases of design and also the goals of universal design that are addressed and met by the different solutions that you use on the site. And it's also a certification program. So this tool can, we're rolling out later this summer, the ability for people who are designing public spaces or different organizations to get certified in implementing universal design in their space. And we can talk much more in depth if you have future questions about certification. This is similar to LEED certification, if you're familiar with the sustainability certification for building more green buildings. So please do, if you have more questions about that tool, we'd be happy to field those at the end or even offline after this presentation. So as I mentioned, we have to address both the indoor and outdoor environments when we're talking about environmental risks for falls. There are efforts and best practices like complete streets policies that help to address this in some community environments where we have protected bicycle lanes or protected pedestrian walking zones. You can see here's a picture of a complete streets implementation in New York City, where there's on the left side, you can see on the sidewalk, there's a protected area where you see folks can sit outside of the retail shops, pedestrians walk in the pathway in the middle, but there's also sort of this protective barrier created by the vendors who are on the street, who also protect the pedestrians from the moving cycling traffic or rollerblading traffic in this example that might be adjacent to them. Wider medians, very distinct crosswalks with enough time to cross the street, these types, and places for rest breaks even in the medians in the middle of the street, can create safe spaces for people to walk and hopefully reduce the risk factors that are related to falling out in the community. Another example of an area where we need to address fall risk factors is in transportation environments. So when people are using public transportation or taking active transportation modes, walking, riding their bicycles, they're going to encounter environmental barriers that need to be addressed in these community spaces as well. And some of the most common, we'll move on, to the next slide so I can show you. Some of the most common features in the outdoor environment that are high risk for falls are features like sidewalks, curbs, and streets where people walk. And one of the things that is not matching up right now is that walking is promoted as one of the best forms of physical exercise, particularly for older adults. And it is the more preferred form of exercise for a vast majority of older adults. So if as health professionals we are out encouraging our clients and our patients to get out and do more physical activity and more walking in order to stay healthy, then we also need to be cognizant that the environments in which people are walking need to be safe for them to walk. So that has created sort of a real issue that is brought to light related to fall prevention. So we're increasing the promotion to walk as a critical approach to disease prevention in our communities, but we're not doing a whole lot to address the environmental risk factors that make walking safe. And it's really not just for older adults, but for everyone in our communities. So that's kind of where we're going to transition into thinking about what are age-friendly communities doing to help address some of these issues. So in the United States, the AARP hosts our network of age-friendly communities that are a part of the global network of age-friendly communities through the World Health Organization. And AARP's efforts to educate different municipalities and governments about what creating livable communities means has really started to bring to light some of these issues related to environmental risks and fall prevention at the community scale. One of the tools that they offer as a way to sort of evaluate how your community might be doing related to different domain areas, from housing to transportation environments to the quality of the environment, is called the Livability Index. And you can go on and type in different zip codes, and I'm not sure if this exists for areas in Canada at this point in time, but the tool, you can type in different geographic locations at different scales, and it tells you using various metrics, and each of these domain categories outlines what metrics they're using to create these scores, and it gives livability scores. So this can just be a starting place to give you information about the quality of your community related to these factors. It also lets you prioritize different factors, so you can specify if you want there to be a focus on walkability, for example, and see what metrics they're using to measure the walkability score, if you're familiar with that kind of score. Some other efforts in age-friendly communities include tactical urbanism efforts. So here in Buffalo, we have a community advocacy organization called Go Bike Buffalo, and they're engaging community members and actually participating in creating some of these changes in our community. So going out and actually doing a physical demonstration of what safer streets would look like, and then evaluating whether that has an impact on if people want to go out and be more physically active and walk in their communities or bicycle in their communities. But really, a really nice approach of tactical urbanism is the engagement of the community in the process. So it's both an educational opportunity to learn about inclusive design, but also an engagement opportunity for them to participate in the process. Another example from around our area, it was led by a local municipal government that wanted to propose installing a roundabout or a rotary in an area that didn't have one before. But rather than just moving forward and funding it and doing it without any kind of community education and input, they took the approach to install a pop-up roundabout for a small amount of time where people were able to really experience what a roundabout in this area, the impact it would have both on traffic but also on the pedestrian activity in this area, and they used it as an education opportunity and an awareness opportunity for the community members in this area to give feedback on how it went, and also to learn about the impacts of different environmental implementations like this. And I'm going to turn it back over to Jordana to talk about some of her specific research that relates some of these different environmental interventions at the community scale to how people perceive our environments around them and how that might impact their physical activity behaviors.
Thanks, Brittany. And so the point I want to make with this slide is really, Brittany talked about a lot of specific design features that can be implemented in a community, roundabouts, different bike lanes, etc. But what my research finds and what others have found is that it's not only the implementation of these features that are critically important, it's that what impact do those features have on people's perceptions of their environment that really impacts their behavior and affects changes in behavior. So, and not only is it just this idea of perceptions that's important, what I also found is that these perceptions vary by geographic type. So, for example, across the neighborhoods, people found that when there's short blocks in these four-way intersections, otherwise known as street connectivity, and there's lighting and different measures in place that gives off feelings of safety, that those design features overall have the greatest impact on people's positive perceptions of their built environment and increases the likelihood that they will walk and engage in physical activity in their environment. And then when we drill down in suburban locations, perhaps not so surprising, it's having this perception that there are destinations to walk to increases the likelihood that people will walk. And then finally, in rural locations, perceptions of safety, and specifically crime safety, and perceptions that there are walking and cycling facilities in the area, all impacts whether or not people are likely to walk. So again, it's this idea that the features are great, but what impact do they have on people's perceptions and how people feel about their communities is really even more critical. And so just in our last few minutes together, Brittany and I just wanted to tease you with some resources and some tools that you can use to hopefully get started in thinking about ways to increase inclusive design in your age-friendly communities. And so Brittany discussed this age-friendly initiative at the national level that is going on. And here in Erie County, which is our Western New York county, Brittany helped to launch the Age-Friendly Erie County. And it's really this initiative that is trying to bring together people who are already doing the good work. And it's not about reinventing the wheel, but it's about bridging connections between the needs of the community and those who are doing something already to address that need, and really about facilitating relationships. And so it's a great model that others can use. It doesn't require a lot of funding. It's really about making this bridge between the work that's being done and the needs that exist in the community. Oftentimes it's about just educating the community that these resources already exist and how can they take advantage of them. Now at the Idea Center we have a lot of resources related to inclusive design at a general level, but focused also on housing, on transportation, and even beyond our publications. There are tremendous resources out there that we can help guide you to if you have questions. And if you go to our website, and we'll post that at the end, there are a lot of free resources and downloadable resources that are available. And then finally, we have an online education program. So we have one, others offer online courses, and it's a great way to learn more about specific topics. We offer them probably every 6 weeks, new topics, and more information can be found on our website. And you can get continuing education credit for accessing those courses and taking those courses. And finally, I'm just going to post this about our sponsor, which is the National Institute on Disability, Independent Living, and Rehabilitation Research. And then I'm going to leave this slide on for a little bit while we gather some questions, how you can get a hold of either Brittany or myself, our website. We're quite active on social media, posting news-related content, so feel free to join us there. And so I know that there's a poll that needs to be asked again, but we can always come back to the slide if people need it. But I'm going to, sorry, I'm reading the questions at a time, and let Marielle take over.
Thank you so much, Jordana. We can leave it on this slide for a little bit in case anybody wants to jot down the contact information, and the slides will also be shared to everybody who's attended this presentation as well. So I will address the first question that has been asked by Anna Dinkowicz. She asks, is it possible to get access to the 2014 Maisel article on value of perceptions?
Yes, I can easily provide that. Whichever way is the easiest, I can easily get that to you.
Yeah, I'm not sure if it's available for public access, then you can just provide the link. But if it's not, Jordana, perhaps if you'd like to send it to Anna directly, I can pull her contact info and get you two connected.
It's a published journal article, so it will just depend on Anna's access to the publication itself, but we can always get the article to her specifically, so just let us know.
Perfect. Thank you so much. I guess we'll just move right into the Q&A. There's another question from Bridget Lewis. What is the cost for the 6 weeks session? And I'm assuming that's for the online learning module.
Oh, so our online courses, they're actually currently 4 weeks long. And they're available for, you get 15 continuing education credits, and I think they're $250, which is quite affordable in the continuing education realm. We are developing shorter 1-hour modules just because we recognize people don't have that time commitment. So within the next few months we're launching 1-hour modules that will be much more affordable. I mean, I think we're thinking $25, so all within a reasonable amount. So I would just stay tuned or go to our website to learn more about the courses, and you can subscribe to our distribution list so that you can be notified when those courses come out.
Oh, I'm sorry.
Wonderful. Thank you, Jordana. Oh, no worries. Karima, the next question was just asking to come back to this slide because they wanted to get a little bit of more information on your sponsor. So we'll just leave it here for a little bit. I don't know if you want to speak again to your sponsor.
I'll just very briefly. So NIDLR has been extremely supportive in all these efforts, but we have 2 multi-year, multi-million-dollar grants from NIDLR. One is focused on universal design and the built environment, and a second one is on accessible public transportation. So at the beginning you heard in our bios this RERC, which is a Rehabilitation Engineering Research Center. NIDLR funds over 20 of them across the country, ranging in topics, but they all have a disability focus to them.
Great. Thank you so much, Jordana. And so while we wait for some more questions, I just want to thank our presenters, Jordana and Brittany, for a wonderful presentation. I can definitely admire how multidisciplinary your team is, hearing about what you're doing at the Idea Center, and considering that falls are such a multifaceted problem that requires solutions from these various disciplines. I think it's great that you've been able to address this. And I hope I'm not the only one who thinks this way, but I would also love to see how the two of you and your team have designed your own personal homes, seeing all of these personal or all these real life examples of some of these solutions that you've created. So I think that's great. I'm just going to advance over to our poll slide that I would like our participants to participate in. So this is the second poll rating your level of knowledge on this topic matter after the presentation. I'll give everybody a minute to complete the poll. Please rate your knowledge on the specific topic of the webinar after the presentation. Please know that if you have already rated your level of knowledge at the start of the presentation as very high, there is an additional option for even higher if you were already there to begin with at your baseline. And please note that your answers will only be used for internal evaluation, so they will not be published in any way. I'll just give it a few more minutes. In the meantime, we do have 2 more questions here. Allison Lacey asks, is there a cost for the ISUD tool? Will there be a certification fee? And how accessible is it for home builders getting into this sector?
Sure. So the ISUD tool is free to access online and view all of the different solutions. All you have to do is create a login to view all of the solutions that are available on there. And later this summer is when we'll be launching use of the certification program, which does come with a small cost for self-certification of a building and a larger cost for more in-depth consulting or auditing service related to the certification. But it is free to view those resources. And for the second question, how accessible is it for home builders getting into this sector? Right now, I think if that is related to the ISUD tool, a lot of the solutions on that tool relate to similar environments in the home, but it does not currently include home-specific strategies. That is one of our research projects in one of those RERC grants that we hope to incorporate into that tool this summer. So stay tuned for that, but we realize that that's a significant area of need, and our long experience in that area of home design will provide a lot of evidence-based solutions through that tool.
Wonderful. Thank you, Brittany. I have a comment from Julia Miller. Great examples and resources. Thanks so much. And I have another question from Thea Curdy. Have you done any coordination with Evergreen Canada, and has this been coordinated with the Smart Cities initiatives?
I'm unfamiliar with Evergreen Canada, so the answer to that question is no at this point. We'd love to learn what that is. And coordinated with Smart Cities initiatives, we are familiar with those, but none of our formal research is affiliated with Smart Cities.
Great. Thank you so much, Brittany. I'm also going to close this poll here. Just bring it to our Q&A slide. I will read a comment from Marguerite, our coordinator at the Community Practice. She says, for universal design, I think about signs and how tiny the print often is on street signs. And she would like to start a revolution for larger signs with larger print and in the right colors.
And we're actually working on projects here. It's about integrating technology into signs and creating smarter signs. So increasing font size is one thing, but how can we take advantage of technology to create an even more inclusive sign? So we're working on that now. Teaser for the next webinar, perhaps.
Wonderful. Thank you, Jordana, for the inside scoop and keeping us in the loop, which is a perfect segue to our last slide. If anyone has any last questions, please feel free to continue typing them in the chat box. But I'll insert my plug here. For more information about the Fall Prevention Community of Practice, please visit us at please visit Loop at www.fallsloop.com. It is on your screens right now. And I've already thanked our presenters, but I would also like to extend thanks to all of our participants today for joining us and engaging in such a great discussion. And we're seeing a lot of thank yous from a lot of the participants, and they're looking forward to receiving some resources, so that sounds great. Perfect. So before we sign off, being cognizant of time, please don't close the window just yet. Wait until you have been redirected to the next screen where there will be a brief evaluation survey that will launch in your browser. And we'd appreciate if you could provide us with some feedback so we can continue to offer high-quality webinars. And last minute thank you to Jordana and Brittany for being available for this presentation. And thank you all for joining in. Have a wonderful day. We'll see you next time.
Thank you.
Bye everyone. Thank you.